Hi there, I'm Dr. Martin Benfield. I'm a GP trainer, and this video is to describe how to explain conditions and what sort of information to include. It follows on quite nicely from the last video, which was about how to describe your differential diagnosis list out loud. And then the next video is going to be about how to make these explanations interactive. And then I'm going to have another video after that where there's going to be a real example. So I'll probably look at explaining something like heart failure. In this video, we're going to be looking at the sort of information to give and how to give it. And it follows very similar to informed consent. The person has to understand the information. It has to be the correct information to be able to make a decision, and they have to be able to remember what you've said. There's a balance with the understanding aspect. If you make the explanation too complicated, it won't be understood. If you make it too simple or analogies are used, it can be misunderstood. Working out how to explain things is tricky. As doctors, we have layers of knowledge: anatomy, biochemistry, physiology, pharmacology. When we think about explaining something, we've got a picture in our mind of anatomy and how drugs work, and we're going to be handing over that information to a person who probably doesn't have that kind of level. So it's very hard for us to understand how that information is being interpreted. Most patients won't have that, and so therefore these explanations don't happen well by accident. They need planning and reflection. They don't tend to happen the first time we try them. My advice would be, every time you learn a new topic, or for example, it might be just a medication that you're learning about, have a think about how you would explain that topic or that bit of the topic to a patient. Write it down and have a plan for it. Maybe if you've seen a patient and you think, okay, how could I explain that better? Write it down. Write down a plan of what you would do. Or you could feel like you want to work down a curriculum list, which is fine as well. Start with the simplest explanation you can and then build it up. Look at the words and phrases you've used. Would you have understood them when you were 14 years old? Could any of those words or phrases be misinterpreted? Could they mean more than one thing? And make sure you practice this out loud. Things always sound different when you say them out loud. The pace needs to be slow enough that the person can process what you're saying, but not too slow that it sounds patronising. All patients have a different level of background knowledge and a want for information. So it's easier to start simple and then build up than to plan for a full explanation and then in real life with a patient have to try and simplify that. In terms of the correct information to give, we can divide this into the doctor-centred and patient-centred information. So the doctor-centred would be the information that you as a doctor feel that the patient needs to know to make an informed decision and understand what's happening. Whereas the patient-centred information will be that information that the patient is going to be really important to them, and specifically to that individual patient. If the patient can receive both sets of information, then in an understandable format, then we're setting up the consultation to finish with a shared treatment decision where you can hand over to the patient ownership of that decision, and then hopefully they will be more satisfied with the outcome, more likely to carry out the discussed treatment plan, and have confidence to contact if things don't work as expected. In terms of content, Hellman's folk model is important here. His studies showed that people usually wanted to know why the problem has developed. And that's something that's overlooked in a lot of our explanations. They want to know why they've got it and was it something they had done. Another thing from Hellman's folk model that's often overlooked is that people want to know the expected natural history of the condition without treatment. Now, a person can't make a consent on an intervention, if they don't know what would have happened without it. There's been a lot of research into doctor consultations and teaching methods in general, and this has given us important guidance on how to plan explanations, particularly in reference to how well people remember things. There's something called the primacy effect, and that's that people tend to remember best the things they are told first. They tend to remember quite well things that are told right at the end, but don't tend to remember the things in the middle. people also tend to remember the things that are important to them. Now, something that's really important to remember is that if you highlight that something's important, people are quite likely to remember that as well. Overall, people can only remember a certain amount of information they're given in one go. So therefore, explanations need to be quite concise, need to include the important things, and try to avoid the things that aren't needed. Use shorter words and shorter sentences so that the person can process the information easily. If a person is trying to process what you've just said, they'll still be thinking about that while you move on to the next topic, and then you probably lost them because then the logical sequence is gone and they've probably stopped understanding what you're saying from then onwards. I'm sure you've come across the advice not to use medical jargon. So these are medical words and phrases that aren't used in everyday language. Having said that, using some jargon is okay as long as it's explained. So for example, telling someone they have atrial fibrillation doesn't help that person to understand what's going on, but they do need to know that's what it's called. Just try and limit medical phrases to a minimum, to the most important ones, with some explanation. There can be, some doctors will use analogies to replace medical terms and phrases, but you have to be very careful with this because these analogies are very easily misunderstood. Other techniques that have been shown to improve recall include categorizing, repetition, and summarizing, and they are all variations on the same kind of theme. We've seen categorizing in a previous video, and this is a form of summarizing before the explanation, and it describes how the upcoming discussion is going to be divided up into logical sequences. It helps the receiver process the information that's then given because they've got a framework of where you're going next, and it also helps the doctor plan for their discussion. Repetition is obviously hearing something more than once, and will improve recall. For example, safety net shouldn't be new information. This should be a repetition of previous information, which is now being highlighted as important and at the end. And summarizing is a repetition of the most important information at a stage in the consultation. So let's move kind of on or back to content. So we need to give a name to the problem, which is usually the diagnosis, explain simple pathology of what's happening, describe how it might have started, describe the expected natural history, look at tests to do, treatments including benefits and side effects, and then finish up with the follow-up plan and safety net. So you can see there's lots of sections here, and that's why you need to keep each section as simple and to the important bits only. That explanation is important to follow the logical sequence because it helps the person process what you're saying. Right, so there's evidence that other resources can help with understanding recall. So that'd be things like using a photo on the internet or drawing a diagram. So try and be in the habit of doing that. If you can do that in every explanation as a kind of matter of routine, that would be a great thing to be doing. There's also evidence on how to present statistics. So if you're too vague, they can be very easily misunderstood. For example, a person might get the impression that everybody gets a side effect, or the side effect's literally 50-50, I will get it or I won't. Real numbers that people can visualize seem to work best. So things like, if there are 100 of you, I would expect 3 people to get that side effect and the other 97 not. If there were 15 of you with this infection and I gave all 15 the antibiotic, 1 of you would get better a day earlier, and the other 14, the antibiotics would make no difference at all. A vital way to improve how explanations are received by patients is to make them interactive and relevant to the patient. And we will look at that in the next video, but as a taster, imagine someone is giving you instructions for getting somewhere. If it's a long monologue, you'll probably remember the first bit and maybe the last bit, but you may forget the bits in the middle. However, if those instructions were made interactive, repeated, and tricky bits highlighted, you're more likely to remember. So if I kind of give you an example, if I told you to take the second left down here and then turn right at the church and then follow a small lane to the end and turn right, and then the car park is on the left. You probably remembered the car park is on the left. You might have remembered that it's the second left at the start, but you might have forgotten the bits in the middle. We role play a kind of example of doing that as an interactive way. So you take the second left down here and then then bend right at the church. Does that make sense? Oh well. So second left, and then is that a right turn, or does the road just bend to the right? Yeah, it's an actual right turn onto a small lane, and then at the end of the small lane you turn right again. You're going to the lake, aren't you? Yes, I am. Yeah. Well, you will see the lake in front of you at the end of the lane, and that's where you do the right turn. Oh, so the lake. I'll turn right, and the lake will be on my left. Yeah, that's right. That's correct. Turn right, the lake will be on the left, and then the car park is in front of the lake, just ahead of you there. There are a few instructions there. Did that make sense? I think so. So it's the second left just down here. Then the tricky bit is at the church, you take the right turn onto the small lane. At the end of the lane, you'll see the lake in front of you. That's where you turn right. Lake will be on the left, and the car park will be ahead of you. Don't know whether that helps. Highlight the point. So to follow my advice, I'm going to repeat what we've covered today. So when studying topics, make sure you use how to explain the condition as part of that learning process. This is good for patients, but also saying things out loud helps you remember things. There are a lot of aspects to an explanation and management discussion, so concentrate on what is really important. Start with the simplest explanation you can and then build it up. In real life, you will add into your template the things that are important to the patient. And remember that people remember what they're told first, last, and the things that you highlight that are really important and the things that are important to the patient. Start with categorizing what you're going to discuss. Don't be afraid to repeat bits and highlight what is most important. And in the explanation, include why the condition developed and an expected natural history without treatment. Use photos and drawings as appropriate, and use real life numbers if using statistics. And finally, make that explanation interactive. I hope that made sense. If not, you can watch it again. Look out for the next two videos being added. If they're not on there yet, then subscribe, and then you'll get an alert when they appear. Okay, good luck.